thanks to the Caribou community, and especially Christina, Catherine, and Jennifer for putting together this symposia. I'm going to talk about work done in our P20 Center, which was to apply nanotechnology to advance urologic research. I'm going to talk about one specific project, though several have been successful, and I'm going to just mention those at the end. But this was a project in which we used the nanoparticles to deliver nitric oxide to the corporal tissue, the penile tissue of a rat, to see if it could act synergistically with a PDE5 inhibitor to improve an erectile response in a rat model of prostatectomy. So I just want to acknowledge the people that were involved in this specific project, Doctors Tar, Dragansky, Swadikani, and Friedman. And as I said, this is a P20 center. I act as the program director, and Sylvia Swadikani and Joel Friedman are project leaders. So I just want to describe the significance of this research. The American Cancer Society predicts in 2021 there'll be around 250,000 new cases of prostate cancer, and actually over the lifetime about 15% of men will be diagnosed with prostate cancer. The radical prostatectomy is the most commonly used means to treat localized prostate cancer. And although the long-term oncologic outcomes are very good, survivorship carries a high risk of lower urinary tract symptoms, including erectile dysfunction. A recent report described that 28% of patients self-report ED at 5 years following the prostatectomy. So I think the consequences of erectile dysfunction as a result of radical prostatectomy on lives is often underappreciated by the scientific and medical community. It severely impacts the quality of life, relationships, and psychological well-being of men undergoing the procedure, such that some men are willing to sacrifice survival to preserve potency. At the moment, the current therapeutics for erectile dysfunction are centered on the PDE5 inhibitors, which are the first-line FDA-approved oral treatments for erectile dysfunction. However, their mode of action is dependent on production of nitric oxide from nitrogen nerves innervating cavernosal tissue, penile tissue, primarily through the cavernous nerves. And the procedures associated with radical prostatectomy invariably result in direct or indirect cavernous nerve injury. And with these loss of neuronal inputs, which are the major contributing factors to ED, there's no neuronal impact on which the PDE5 inhibitors can act. So there's a pretty strong rationale for expecting synergy between the PDE5 inhibitors and nitric oxide releasing compounds or nitric oxide releasing nanoparticles. The nitric oxide nanoparticles will release nitric oxide, which sort of circumvents the lack of signals from resulting from cavernous nerve injury. And the PDE5 inhibitors will then amplify their effect, amplifying the downstream molecular pathways leading to an erectile response. So in these investigations, we've investigated the ability of topically applied nitric oxide nanoparticle releasing nanoparticles to act synergistically with sildenafil in eliciting an erectile response in an animal model of nerve injury of radical prostatectomy. So the model of radical prostatectomy that we use is one of severe cavernous nerve injury. We transect the cavernous nerve 1 week prior to determining the erectile response to treatment. And I just wanted to take a moment to discuss the physiological experiment itself. We have a pressure transducer inserted into the corporal tissue or the penile tissue. It measures intracavernosal pressure, and we have a transducer in the carotid artery, and this gives an output called the intracorporal blood pressure ratio, which is commonly used to measure an erectile response. So in these experiments, there is no cavernous nerve to stimulate, so any erectile response is resulting from the chemical treatments we apply. So in this rat model, prior to the measurement of erectile function, we give them doses equivalent, oral doses equivalent to a patient dose of 2.5 or 0.25 milligram tablets. That's sort of in the range of 10 or 100-fold less of the minimum recommendation for human patients. And we combine that treatment with 250 or 100 milligrams of the nitric oxide releasing nanoparticles. As a control, we used blank nanoparticles. And then, as I say, we used this physiological setup to measure erectile functions based on the time to the first erectile response, duration of the erectile response, maximal and average intracorporal pressure response, and the number of spontaneous erections per hour. So this slide basically summarizes the main findings as an example of one trace, although this was repeated in 8 animals. When we apply the nitric oxide nanoparticles alone, then we get a spontaneous erection on average at 22 minutes after application of the nitric oxide nanoparticles, and usually we would get 1 or 2 erectile responses. If we pre-treat with the PDE5 inhibitor sildenafil, we not only get an earlier onset of the erectile response, but we get a big increase in the number of erectile responses. So summarizing all the data in this slide, if we just treat these animals with sildenafil or blank nanoparticles, we don't see any erectile responses. If we treat with a high level 250 milligrams of the nitric oxide nanoparticles, the time for the first erection is about 20 minutes. But if we combine with sildenafil, the time for the initial erection goes down to about 10 minutes. And if we look at the number of erectile responses per hour, if we treat with the nitric oxide releasing nanoparticles and a low dose of the sildenafil, then we see almost double the number of spontaneous erections. So the conclusions is that although there's a strong rationale to expect a synergistic effect between PDE5 inhibitors and nitric oxide, our results are the first really providing evidence of such a synergy. And our results suggest a novel treatment strategy for patients with ED following radical prostatectomy, where an oral PDE5 can be used in combination with therapeutics, which topically deliver nitric oxide to corporal tissue. And I know there's a session coming up later about collaborations, and one of the goals of this P20 was to encourage use of nanoparticles, nanotechnology in research, in benign urologic research. I haven't got time to go through them, but we have published papers using these nanoparticles with Johns Hopkins to investigate detrusor overactivity in transgenic sickle cell mice. We've had a publication with Department of Physiology and Biophysics in Einstein to show the involvement of a peptide in mediating nerve regrowth after cavernous nerve injury. And our collaboration with Xylo Therapeutics that I just described has led to funding for through a clinical translation grant from NIH, a phase 1, a phase 2 STTR, which we just initiated to optimize the microparticle, nanoparticle-based topical treatments to treat erectile dysfunction in patients refractory to oral PDE5 inhibitors. So just very quickly acknowledging the involvement in this work of my lab, Dr. Swadikani's lab, Dr. Friedman's lab, and Dr. Andrew Dugansky, who is at Xylos Therapeutics. Thank you.